Today, I will discuss observations and the effectiveness of art therapy in risk management. Introduction. I'm working in the hospital and the community sites for adult mental health service in NHS for my placement. I experienced that observation skills are essential for the effectiveness of art therapy in risk management. From the HCPC standards of proficiency, observations is part of our duty of care. Observations is a key aspect of the responsibility for the safety of other people and the well-being of the service user in the room. For the open group in a male ward, a safe and effective therapeutic environment provides the space for the service users to process their emotions and feelings through art making securely, facilitate group sharing, and build up the therapeutic relationship between the art therapist and the service user. Observations is a common procedure but controversial because patients may feel outpaced. Therefore, observation skills are essentials. For example, changing the philosophy of observations from control to care can have dramatic effects. Observations and risk management before and after the session. The structure of an inpatient ward can significantly affect how observations is undertaken and the patient's experience. In the acute setting, levels of observations will determine patients' access to art therapy. We have a meeting with all staff in the ward every morning before starting the group. The patients and their conditions can vary day by day. This information from the meeting and the ward observations will help us make the final decision on whether the patient will or will not be invited to the open group. Even the group will be cancelled if the ward is unsettled and unsafe. We work in a team with 2 art therapists and about 6 patients for the art therapy group in the ward. 1 to 2 staffs may join us in a group. Open groups often include staff engaged in close observations, particularly level 3, 1-to-1 observation within eyesight. The front door and office of the ward are locked. We have to use the smart card to access the ward. We must wear a personal alarm before entering the ward and report the group situation in the meeting with the ward managers after the art therapy session. Also, we have to put the progress log onto the NHS record system after each session. Observational skills are critical to taking a comprehensive health history to understand patients' current situation and risks, helping us to become keen observers, recognize patterns, analyze behavior, and reinterpret observations are fundamental skills needed for clinical reasoning. Observations and risk management during the session. To maintain the effectiveness of the art therapy group, we have to balance vigilance, curiosity, and respect during the session. Fostering skillful use of the sense, observing, hearing, and smelling is critical to developing clinical competency. Enhancements of observational skills is essential because they are the basis for the initial assessment, history taking, physical examination, and diagnosis of patients' needs. In addition, Observations must extend from the patient to the environment within which practitioners see patients. Therefore, in the session, we should observe service users' behavior and mood. The patient's emotions and behavior can vary from time to time because of their medications, health conditions, and the environment. Besides, we have to keep our eyes on the patients while we are making art alongside. I experienced that a patient drew something about religions and war, which provoked an argument between another group members. We had to be alert and stop them, separate them immediately to eliminate the conflict. We should keep a secure distance from our patients and be aware of the actions of the patients, as some patients hugged and kissed my colleagues in the sessions before. How are they treating the art materials? I saw a patient became irritated suddenly. He dropped the paddle on the table heavily and lost his temper and wanted to push the others. We asked for help from the staff and immediately took him away from the group to avoid an incident. How are they treating me? Most of them, patients, are respectful and polite to me and other staff members. They can listen and follow instructions and maintain boundaries during our sessions. But their mental state can be observed through their eyes, sitting posture, gesture, movements, and the sounds like communicating with me. Team always provides you with a current assessment of risk. For example, risk to self, risk to others, and risk from others. I'm working with my supervisor and staff in a ward, which makes me feel safe and I can focus on my group and assess them in the sessions. In conclusion, observations and risk management can significantly influence the effectiveness of art therapy. The art therapy group can operate safely and effectively in the ward by applying observation skills, caring about the patient's conditions, understanding the patient's safe and dangerous behavior, and acknowledging the working environment. It also facilitates the art therapist to observe images of the service users in order to help patients express their deep down emotions and unconscious materials verbally and non-verbally in a safe and respectful environment. This is the end of my presentation. Thank you.